Hello guys, my name is Nikolai Yusupov. In this video I'd like to show you how to set up an arterial transducer or a central venous transducer and how to connect it to this LifePak 15. Here I have some of the equipment to show you what you're going to need, right? So for you to set up a transducer, you're going to need a transpack, right? A transducer set. You're going to need an IV fluid, right? Here I have 1,000 bag, here I actually have a 500 bag, and you're going to need a pressure cuff, right? And you're going to say, well, which one is correct? Is it the 500 fluid or is the 1,000? So it all depends on what is the bag and the actual cuff that you're employing for the pressure, right? So this is the pressure infuser cuff, and you notice, right, it's made to hold 500 ml bag, right? So here it says 500 ml. If you look at this is actually inside of this is a 500 ml normal saline, and this accommodates a 500 ml infusion, right? So this transducer on this side is already set up. I already set this up because I wanted to show you, right, how to do both the CVP and how to do the arterial. The setup is going to be the same. So I already employed the 500 fluid here. I'm going to show you the 1,000, right? The concept is the same, but do not employ an 1,000 bag to fit this pressure cuff. Why? Because it's not made for 1,000, and if you employ it, what you're going to do is you're going to either overpressurize it or underpressurize it, and you may not have the appropriate readings. So always be cognizant, right? What is the pressure infuser? Is it 500 or 1,000 ml? And then choose the appropriate bag. So this is the appropriate setup. This would be an appropriate setup, but the reason I'm using it is I don't have any more 500 bag. All right. So this is what you're going to do. You're going to open your fluids. Right. Try to keep your baggage, garbage, right, tucked away so you're not making a big mess. So I got a normal saline. You always employ the normal saline. You do your ice integrity clarity expiration. So I see no air bubble. I see no particulate matter. Expiration date is 6/25. Right. Normal saline. So that's appropriate fluid, but it's an appropriate size. So I would not use it in real life. Right. And the next thing you're gonna do is oftentimes when you see videos, they teach you to put it into this pressure infuser and pump this up. Do not do it. The reason why is the manufacturer says you wanna flush this transducer via gravity so you don't make micro bubbles. What are micro bubbles? Micro bubbles is the bubbles that you will see in the tubing, and if the patient gets those, they may get an air emboli. So you do not want them to have that. So got my fluids ready. I'm gonna open the transducer. So it's sealed from the factory, right? This is how it comes. And you notice there's a couple of things in here, and do not throw them out because you're going to need it. When you open this up, you have the labels that denotes, is it arterial, right, atrial pressure, central venous pressure, pulmonary artery, left atrium, right? So you got the labels, which I put here. I use this box to basically flush my line. These are very important caps. The caps that are currently on, they have holes. They're called fenestrated caps, right? These caps do not have holes, and you're going to replace these caps with the fenestrated ones, right? The reason why you need holes now so that we could flush the system. So we got that. You're going to need the appropriate size cable that connects to your LifePak 15 right here. So I got the cable. The next thing I do is when I take this out, right, I take all the stickers off, right, and I usually just put it in the box. And always check from the factory, right, if all your connections are actually tight. So which connections I'm referring to. So if I come over here so you guys can get a clear picture, right? This is what I'm referring to. These portions right here. See how it's loose? You see how it's dangling about, right? You start to flush your fluids, you will have fluids squirting all over the place. So I always check that this is connected, and then this is your actual transducer, right? Again, it's loose. I want to make sure it's tight, right? So that's tight, right? That's good, right? And right. This is you're gonna see two different transducers. So here it's a pull. You'll pull on this in order to move the fluid in the tubing. Some of them you push on the side like two buttons, right? And that will facilitate that, right? This is your drip chamber, right? And this is your roller clamp. I usually close this. So I said we're gonna flush this transducer utilizing gravity, right? So what I'm gonna do is as follows. I'm gonna take this bag, this here, right? This is my port where I'm going to connect it to. At this point, you want to have your gloves and your face mask. Why? Because this is going to go either via RV or central venous pressure. So you want to make sure, right? Use your gloves. You use your face protection, right? So everything is safe. So this was my transducer, right? I close this portion here, remove this cap, right? And I'm going to spike my bag, make sure this doesn't come into contact. So I spike my bag, and then I usually fill the chamber halfway, right? Notice this is closed. Now, what you want to do is, you notice this bag has air in it, and I want to de-air the bag. How you're going to de-air the bag, I'll show you in a second, right? So you're going to first find the first part that this connects to. So, right, this would be the transducer. So you see how it comes out is the transducer. Where this stopcock points to, that portion of the tubing is closed. So it's closed to this port. If I move this here, then I'm closing everything downstream here, right? So I'm closing everything down, right? So this is what I want. I want this to be down to the rest of this tubing. So I'm only flushing this part of the tubing and I'm de-airing it, right? So this will be the first part that you do, right? So I closed here, stopcock pointing down. Next thing I'm going to do is I'm going to take this bag off, right? I'm going to flip it upside down and you see all this air. I'm going to open my roller clamp right here. Roller clamp open. And then what I'm going to do is I'm going to pull on this pigtail. You see what I'm doing? I'm pulling on it and then I'm squeezing my bag. And the goal of this is that I want to get all this air out of here. Why? Because if this air goes into the patient under pressure, right, you're going to cause an air embolism. So you may not be able to get all of it out. You do the best you can, right? Right, so now that you see, right, so we got most of the air out. I have just a little tiny bit left, which I will get rid of in a second. Yeah, pull the pigtail. Right, and this is the best you're gonna be able to do, right? And we got most of it out, right? So now we got most of the air out. I'm gonna hang the bag up, right? And now I said this part is open. I got my transducer in my hand. I'm using this to essentially flush it via gravity. So what I'm gonna do, you will see, I'm gonna pull on this pigtail, and the saline should come out of this port right here, right? So let me make sure you guys can see. And what I'm watching for, I'm making sure all these air bubbles, right, come out. So I have no air bubbles, period, in the system. So what I'm gonna do is I'm gonna open it here, right? And you see all the air bubbles are coming. So it's open here, right? And as I'm pulling the pigtail, right, you see the fluid coming out. So I look at my tubing, I see no air bubbles, right? So this looks clear to me. If you saw any more air bubbles, you just continue, right, doing this. Now what I'm gonna do is I'm gonna close this stopcock. So this part is closed now. Now I'm gonna flush the remainder of it. So I'll take this off. I'm gonna extend it, right? So now from the transducer to this part, right? So this part is closed. I'm gonna close the stopcock towards the very tip. So now this is closed. So I expect to flush this portion of my tubing from the transducer up until here. So I'm gonna again find my pull tab right here, and I expect it to come out from here. So I pull. And what I want to see, right, I want to see all the air bubbles come out. It's a little uncomfortable to hold this like this, but you guys will see. Right, you see all the fluid is coming out. I check my line to see if there's any air bubbles. See some air bubbles, so I'm gonna keep doing it. Pull on the pigtail. All right, so now check my line, right? No air bubbles. I'm now gonna close this off, this port off where it points to, and now this part of the line is the last remaining part that I gotta flush. So again, I pull on my pigtail, right, and I flush the remainder. See that right comes out. So now I double check. I see no air bubbles remaining here, right? Everything's flushed. I said the next step is we gotta find these fenestrated caps, which have holes in them, and we gotta replace them with non-fenestrated caps. So this is my non-fenestrated caps that were already in the packaging. Do not throw them away, right? So pull here, right? So first one we're gonna do is right here. We're gonna remove this blue one on the transducer, and I'm gonna replace this, right, with the one that does not have a hole. So fenestration means there's a hole. Non-fenestration means I take away the hole. So remove the hole here. This one also has a hole right here. Remove this, replace it. And then the very tip also has a hole, the very bottom I should say, right? So I remove this and I replace it with like so. So now we are flushed. We flushed the system, we made sure there's no air bubbles, right? And we removed all the fenestrated caps and we replaced them with caps that have no holes. The next thing that I like to do is, this is the part, right, that we have to pressurize. So this is where the manufacturer says you're going to pressurize your fluid. Once again, this bag is not rated for it, but I'm going to put it right in here so I can show you what 300 looks like. But you use the appropriate size bag for your fluids. So it will be essentially placed under here. Grab it at the top and then you slide it across. This portion goes under here and your bag will rest like so. Yeah. So now I'm going to hang this up. So once I hang this up, you see how the bag protrudes because this is not made for the 500. What I'm going to do is I want to pump this up until it says 500. So I'm going to look at this dial until it's correctly pressurized, 300 millimeters of mercury. So we're going to inflate with this off portion to this side, so the air is coming into the cuff. So I'm looking at this gauge right here. As it pressurizes, I'm looking for the green. Green means it's 300. So 150. All right, green comes out, 300. I see 300. And then you're gonna close this off so no air is escaping. This is what you're gonna do, right? So now we pressurize the system. How do you know you did it right? If you did this right? If I pull on this pigtail, right, you should have normal sealing coming out under pressure, so it's going to be high pressure. So let me take this off, remove the cap, and I pull on this pigtail on the transducer. Right, you see how it comes out? So we did this correctly. I'm just going to replace the cap here. So now our transducer is all set up, right? So this part is already set up. Now I'm going to show you the connection that you're going to make that's coming to your monitor. And we said that this is going to be an arterial line. So from your labels, what I like to do is I find my arterial label and I put it directly on the transducer, so whoever is using the system, flushing it, they know what they're working with. So I put the arterial right there, right? The labels come with your transducer pack. Now you have the LifePak 15. You're going to turn this on the models that are capable of doing this. You're going to have P1 and P2, right? So I'm going to, for the demonstration purposes, I'm going to connect it to P1. So this cable goes directly into P1. And this portion, it looks like exactly like a phone jack, if you remember the old school phone jack. This is where your transducer basically connects, right? So you're going to find it and you're going to snap it in like this. The moment you do it, you see how it automatically pops up. It tells you P1, not 0, right? So if you want to be in P1 mode, you could run your arterial pressure. You're going to get your systolic, diastolic, and mean pressure. However, I could change the label. I can just use my wheel to highlight this area, select it, and from the label I select ART, right, arterial line. So I hit it, right, so you see a label arterial line, auto scale, it will automatically scale, and then I move my wheel on the display. On here, I select waveform, and I select ART. So home. So you'll see now arterial line shows you systolic, diastolic, mean, and then you see the arterial waveform right here appearing, right? If I wanted to do a central venous pressure, I would just basically come down here. Instead of say ART, I will select CVP, click home, and then on here it will automatically change to CVP. And you notice it doesn't give you any more systolic, diastolic, it only gives you mean, because CVP is only measured in mean, right? A normal CVP is 2 to 6, right? 2 to 6. Arterial pressure depends on the patient. So let me go back to the arterial form. I'm going to put ART back because we're doing arterial line, right? So select it, and then you see everything is correct. The only thing is notice P1 is not 0, so we didn't zero it, right? So how would you going to go about zeroing it? So this is very important. For you to zero the transducer, you have to put this portion, right, which is the transducer, at the patient's phlebostatic axis. I'm going to show you on the iPad the location, and then I'll show you on myself how that looks, right? So this is, imagine this is the patient, right? The phlebostatic axis is located at the fourth intercostal space, AP, a diameter of the chest, or anterior posterior diameter of the chest, or we usually call it mid-axillary line, under the armpit, right? And what you want to have at that fourth intercostal space is this portion of the transducer. You see where my finger points to? This that I will open, right? That we replaced, this cap. This was non-penetrated cap. So this portion is going to be exactly at fourth intercostal space, mid-axillary line. This is what we call phlebostatic axis. So this is where we essentially going to place this on the patient. Why? That gives you the most accurate pressures. How would you go about finding it? I'll show you on myself. On myself, I find the sternal notch, manubrium. Right corresponds to the first intercostal space, right? First intercostal space. I work my way down, first, second, third, fourth. It's about nipple area, but don't use the nipple area, because on patients' anatomy it might differ. On me, it happens to be the nipple area, right? So fourth intercostal space, mid-axillary line. So what I would do is, on a patient that I'm doing this on, obviously they're going to be on the bed or on my stretcher, I'll take a piece of tape, take like a cloth tape, right? And what I'm going to do is I'm going to place the tape like so, right? Place the tape like so, and then I'm going to tape. Let me take off the gloves so you guys, so they're not in the way. So put the tape like so. We said mid-axillary line, so right under the armpit, right? And this portion should be fourth intercostal space, right here. So I'm going to tape it like that. So take good pieces of tape, which this is not, right? Take a good piece of tape. A cloth tape will work better because it will stick much more readily to the patient. And this is where I'm placing it on, right? Like this. So this is how it's going to get taped. I usually tape it on two sides. Fourth intercostal space, mid-axillary line, the phlebostatic axis, for you to obtain the most accurate arterial pressure or venous pressure, right? So we taped this to the patient. So now pretend this is already on the patient. And we connected it to the monitor, which I already showed you, right? I removed my label, so let me relabel it again, right? All of this you're doing, right? You're using your face mask, your gloves, and so forth, right? I took the gloves off now so that I can show you easy connection, so you guys can see. Now we said if we are doing the arterial line to the patient, we're going to pretend this is an arterial catheter, and we're going to say we're pretending that this catheter is running on the patient's radial line. So imagine I'm laying right here, and this catheter is sitting in my radial artery, right? So this portion of your transducer is going to be connected to the arterial line. So you want to definitely use your face mask, aseptic technique, right? And you're going to connect it like so. I'm going to put another tape here so it doesn't move. All So we're gonna pretend, right, we connected our setup to the patient, right, so that you guys can see it clearly, right? So monitor is done. This is phlebostatic access, fourth intercostal space, mid-axillary line. Your bag where you hung it, it doesn't matter, I usually put it right on the stretcher, right? So now what we gotta do is we gotta zero the system. It's not zero. So what does all that means? It means when I zero the system, I'm gonna take away the atmospheric pressure away, and so what the machine is reading, it's only reading the pressure that the patient is making. What the transducer does, it's a strain gauge. So it's measuring the fluid pressure, and it's converting to an electrical signal. So it's measuring the pulsations of the fluid in the artery, and it's converting it directly to the electrical signal. So what you're gonna do is as follows. On the transducer itself, you're gonna find this port, and you see where it points to, that portion is off. So it's off to the side, and you notice how all of this is going to the patient now, right? So what I'm gonna do is I'm gonna turn this off to the patient. So I turn my transducer off to the patient. I'm gonna open my cap. If you did this right, I'm gonna pull on the tab, and you should see normal saline come out. See how it's dripping? When the other side, no saline is coming out. So then you say, oh, I messed up, I gotta close it to the patient, right? You see fluid come out, right? Now we open to the atmosphere. What you're gonna do now is you're gonna move your dial, right? You're able to see the monitor, right? Mm-hmm. You're gonna go in here on the P1 or arterial label, and you're gonna say 0. You're gonna scroll down, you're gonna click 0. It says P1 0. It will automatically zero the system, right? You don't have to do anything, you just have to wait. So we're waiting, right? It says P1 0. You're going to then go ahead and replace your cap back. Once I replace the cap, I'm gonna close it off to the cap. So now I have connection to my patient. And right away, you're going to see oscillations. I'm gonna move it myself so you'll see what it looks like. You see how the screen shows you a little bit of a waveform and it gives you numbers, right? It's because I'm kind of moving it, right? But what's gonna happen is, in real life, right, you will see a blood pressure appearing, right? And you could adjust the scale, right? So here, I think I have auto scale, right? But you could adjust the scale any way you want. So let's say we believe the pressure is between, on the patient, maybe it's hypotensive 0 to 60, maybe it's 0 to 120, so pick the appropriate scale. So let me just put 0 to 60, click home, and then let me see what that does. So right, you see the pressure, right, appearing. Now, are you done yet? No, you're not done yet. The pressure is going, right? Yeah, you have zeroed your line, you put the transducer on the appropriate side, but we have to perform what's known as square flush test to know if the system properly damped, over damped, right, and if it needs any correction. So what I mean by all of that. So let me show you again the diagram so you guys can see what I'm talking about. So we're going to perform a fast flush test, and I'll show you the waveforms. So how would you perform a fast flush test? I'm going to quickly pull on this pigtail, and when I do, you'll see what appears as a square wave. Why? Because I'm basically infusing saline into the arterial line. And what you want to see is 1.5 to 2 oscillations. 1.5 to 2 oscillations means the system is properly damped. So you're getting the most accurate blood pressures, and you're going to see a good waveform like this on your monitor with a dichrotic notch, which indicates closure of aortic valve. Now, let's say you do the square wave test really quickly, and all of a sudden you see very minimal or less than 1.5 oscillations, right? No oscillations. And you have absence of the dichrotic notch. So they call this over-damped, and over-damped means your blood pressure is falsely low. And usually they'll tell you, remove the extra tubing. Sometimes you may have excess tubing, or somebody added more tubing than necessary, or you may have air bubbles in the line. So what you're gonna do is look at your transducer, look at all the tubing, take out excess tubing, reflush the system so you have no air bubbles. The other thing that may happen when you perform a fast flush test, you will have this, they call this underdamped, or it's hyperdynamic response. You'll see falsely high BP. So what is this, right? It says adjust the filter setting on the motor, right? So, or there also could be other things like kinks on the tubing, right? Or blood clots in the tubing that can also facilitate that. So again, you want to check your tubing, making sure no air bubbles, no blood clots, no kink tubing that's occurring, right? And what you want to do is when we perform the square test, you're going to see this oscillation. I'll show you what I usually do. So let me come back to the monitor, right? I said to perform a fast square flush test, I'm going to pull on this pigtail real quickly. So pretend, right, I'm going to hit this, so like blood pressure is going, right? So I'm seeing, let's say patient has BP of 90/60. So what I usually do, I click print, right? So the EKG is coming out, right? And then I perform a fast flush test. You see the square waveform, right? And then I quickly look at what happens, right, with my oscillation. So I'm gonna do this one more time. So blood pressure is going, and then I perform a quick flush test, right? And I'm looking, right, how many oscillations. So I'm gonna stop print, take this out so you guys can see, right? So this is the first one that I performed. We're gonna pretend this is the patient's arterial waveform, and this is my square test. And I wanna see, right, for it to be appropriately damped, right? We just said you want to see the one that is at the top, and you want to see, right, 1.5 to 2 oscillations. So when this returns, right, to my baseline, I want to see 1 to 2 oscillations with the return of the aortic waveform with the dichrotic notch. So now I know my system is properly damped. I'm going to put a video clip that I have on a real patient, so you see exactly how it's done and how it looks. So this patient is on arterial line, right? So invasive monitoring, he has a radial A line. So you see here, right, we're having the dichrotic notch. His BP is currently 122/51, 75 on the map, right? And here we got the non-invasive cuff going. I'm gonna show you how to do a fast flush test, and you need that to know if you properly damped. And the way you do this, you basically find the pigtail or 2 press buttons on the transducer, you quickly flush it and you let go, right? So you're basically flushing his A-line with saline. And what you should see is oscillation, like movement up and down. 2 oscillations are good. So what I usually do is I click print, and then I'm gonna come to the patient, right? You can't film this, so I'm gonna just press on his thing, right? So you see, right here was the fast flush test, right? And as we're printing it, right, we're gonna see, right, when we actually hit it, right? So now it came out. I'm gonna click stop. So here, focus on this line right here, right? So we performed the fast flush test, and you only see, right, 2 oscillations right here. So we are properly damped. What happens if you are over damped? Over damped, you probably have a clot in the line. Your waveform looks like this. You lose the dichrotic notch, right? So your waveform looks like this. It looks at the dichrotic notch, usually a clot in the line, or maybe air bubble. And if you are under damped, right, you basically have elevated blood pressure, false elevated blood pressure, and you're going to see a lot of these spiky lines like these, but like it'll be like 7 of them like that. And that usually indicates that the system is under damped. So over damped means clot, or air bubble looks like this. Under damped, a lot of oscillations like that, right? Bad. So I'm gonna do it one more time so you can see. Fast flush, right? You see 2 oscillations right here, so we're perfectly good. We are properly damped.